Sometimes the physical pain you are feeling could be a result of poor mental health. It's all connected, making it hard to treat one without the other. Well, good news for us, Smith Chiropractic is all about the whole body approach to care. Dr. Ammon Jacobson is here to explain how his team is simply the best of the best, better than all the rest. Congratulations, gold medal last year, going for the repeat. First off, how's my posture?
Well, you know, I didn't want to put you out on live air, but we'll talk about this. We'll jump right into it. Okay. Good posture is up, back, and down, and then it's like someone's going to come kiss you and you don't want it. You'd want to retract back, and then air brakes, just relax a little bit.
Oh, my mom loves you. She's always complaining my posture isn't good. That's why I booked in Dr. Jacobson. Best of the best. You know, what does that award mean to you, and how excited you to go for the repeat?
Yeah, and we'd love to do it again, but when we found out, we didn't. I was pretty unaware, and you guys were banging on our door and gave us an award, and so I was humbled. You know, I try to do good work. You know, we just try to keep our heads down and do the best we can, and to be recognized that it was humbling. It really was. So thank you.
You know, May is Mental Health Awareness Month. Here on Loving Living Local all week long, we've been spotlighting, you know, the importance of mental health, and you know, it's that whole body approach where it's kind of the chicken and the egg. Are you struggling physically because of your mentals, or are you struggling mentally because of your physicals? How do you attack this whole body approach, and how important is mental health?
Well, mental health is paramount, and you know, I wouldn't be the primary person to see initially for mental health. You got to talk to your medical doctors for prescriptions, your mental health professionals like counselors, psychiatrists, psychologists, right? But I think the physical pain experience it's just not talked about enough, or is really underrelated in conversations. What I find is that when a patient's in chronic pain, it can have a huge effect on them, right? Especially if it's been long lasting. And this is things like, I'm not sleeping, I'm not able to walk, and then it transfers into, well, I didn't go to work today, or I'm not taking that vacation that I want. So it can have a drastic effect on a patient. And so when we look at a patient, we want to obviously address the physical component of this, and the nervous system connects the brain and the body. And so what we do in Smith Chiropractic is we want to remove the physical component of a patient's problem, which has a huge effect on their mental health. Yeah.
Dr. Jacobs, you've got an incredible team. How are you all utilizing technology? Because you've got some of the finest technology in the region right at your practice, in your office.
Yeah, we try to stay on the cutting edge. You know, probably distinction for us is how we approach patient care. You know, we're not trying to just get you in and out as quick as possible. When you first come see us, it's an hour-long process, and then the second visit's an hour. But we're going to do proper consultation, which means I'm going to talk to you about what got you to the point you're at, proper physical examination. We have digital x-ray in the office, and then when it comes to treatment for chiropractic, obviously we're adjusting people, but we do what's called manual therapy. That's deep tissue massage. We have class 4 laser therapy, which opens up blood vessels, tells your body to heal. Shockwave, which is incredible for tendinous injuries, ligamentous injuries. We also bring in, you know, diet, exercise, posture, as we talked about. Yeah. And then on the neuropathy side, it's a comprehensive program. First and foremost, we want to do a thorough neurologic evaluation, and then similarly, it's approach of it's multimodal. Shockwave, 2 types of lasers, very specific E-stim. We get into diet, nutrition, which is inflammation, work on balance, and really lifestyle. So it's a multimodal approach. It's really what it takes for chronic conditions.
Is this the ideal vertebrae? This is not mine. Mine is like we all crooked. That's why I'm going to you after the show. What are we looking at?
Yeah, this is just a human spine, 3 regions: lumbar, thoracic, cervical. This is the pelvic bowl. So just a teaching tool we use, but chiropractic, we're talking about alignment and function. That's the real thing, is we want to take pressure off the nervous system so the brain talks to the body.
It's all interconnected, that whole body approach. You got a great special, $39 for new patients right now?
Yeah, especially with Fox 21. Anyone who wants to come in the office and mention Fox 21, we have a new patient special, which would take care of the first visit, and then also your first treatment. And then also we're doing some deep discounts, once again, if you want to mention Fox 21 for any of our laser therapy, shockwave, massage. Yeah, we'd gladly reach out and take care of the viewers.
Do you need to crack my back before we go? Do you?
We have to do a proper assessment, right?
Okay, that's why I'm going to go to the office after the show. All right, get started with Smith Chiropractic by calling or heading online, and be sure to mention Fox 21, as Dr. Jacobson said, for that discounted massage treatment or that new $39 patient special. Thanks for being our mental health spotlight. Thanks, Dr. Jacobson.
My pleasure. Thanks for having me.
Vote for them for best of the best.